9 out of 10 people with high blood pressure have been told the cause is unknown. And most adults aren't even getting half the potassium their blood vessels need to relax properly. Those two facts are not a coincidence. I'm Dr. Mandy Thomas, and today I'm going to show you why potassium deficiency is one of the most overlooked drivers of high blood pressure in the modern world, why your doctor probably hasn't brought it up, and exactly what to do about it. Starting tonight. The piece most people are missing costs almost nothing and is available at any grocery store. Stay with me. Before we go further, drop a comment right now. Has your doctor ever talked to you about potassium in relation to your blood pressure? Just yes or no. I want to see how many people watching this have never heard what I'm about to share. Let's start with that number, 90%. That's the percentage of all hypertension cases classified as essential hypertension. It sounds clinical and important. Here's what it actually means. The cause is unknown. 9 out of 10 people with high blood pressure have been told, in effect, we don't know why this is happening. Here's your medication. And somehow, that has become an acceptable answer in modern medicine. We live in an era of MRI machines and genetic testing, yet for one of the most common chronic conditions on the planet, the official position is a shrug. Now, I'm not here to criticize doctors. There are brilliant clinicians doing extraordinary work every day. The honest reality is that dietary interventions are harder to standardize than prescriptions, harder to follow up on in a 15-minute appointment, and harder to measure in a clinical trial. So they get underemphasized. Not out of bad intentions, but because the system isn't built for them. That's the gap we're going to close right now. So what's actually going on? For decades, the conventional approach to blood pressure has focused almost entirely on sodium. Cut your salt, reduce processed foods, and there's some logic to that. Sodium does contribute to elevated pressure in certain people. But here's what almost never gets mentioned in the same breath. What if the sodium story is only half the picture? What if the real problem isn't just too much sodium, but far too little of the mineral that directly counterbalances it? That mineral is potassium. And here's the gap that should genuinely shock you. Your body needs roughly 4,700 milligrams of potassium per day. Most people in westernized countries are getting less than half that, and many people are consuming 3 times as much sodium as potassium, a complete inversion of the ratio your cardiovascular system was designed to handle. Before I go further, nothing in this video is medical advice. If you're on blood pressure medication, do not stop or adjust it without talking to your physician first. What I'm sharing here is designed to help you have a more informed conversation with your doctor and explore options that may not have come up yet. Now, why are most people so deficient in potassium in the first place? The foods richest in potassium, leafy greens, whole natural foods, have been progressively displaced from the average diet by refined and processed foods. And here's the double hit. When you eat refined foods, especially refined sugar, you actually lose potassium from your body. Less coming in, more going out. Stress hormones like adrenaline and cortisol deplete potassium further. If your life is stressful, and whose isn't, you're burning through what little you have even faster. So what does potassium actually do inside your cardiovascular system? First, it directly regulates vascular tone, the level of tension in your blood vessel walls. When your vessels are too constricted, blood pressure rises. Potassium helps keep them relaxed. Think of a garden hose. If you pinch it, the pressure inside goes up. Potassium releases that pinch. Second, it lowers adrenaline levels. Your autonomic nervous system controls automatic functions like heart rate and vessel dilation, that fight-or-flight surge where your heart pounds and pressure spikes. Potassium actively dampens that response. When you're low in potassium, your nervous system is more likely to stay stuck in that elevated state, keeping blood pressure high even when you're perfectly safe. Third, it supports your endothelial layer, the thin inner lining of your arteries that regulates blood flow, controls inflammation, and prevents arterial damage. Adequate potassium keeps that lining healthier and more functional. And here's something most people have never heard. Potassium improves insulin sensitivity, making your cells more responsive to insulin. This matters enormously because insulin resistance is strongly linked to high blood pressure. These systems are all connected in ways that simplified dietary advice never captures. Translation: potassium isn't touching one factor in blood pressure, it's touching almost all of them. Now let me show you how far out of balance most people's ratios actually are. Research suggests that humans consuming ancestral whole food diets were getting somewhere between 11,000 and 15,000 milligrams of potassium per day. Our genetic blueprint was shaped by diets extraordinarily rich in potassium. We're now living on a fraction of that, while loading up on sodium and refined carbohydrates. The ratio has completely inverted, and blood pressure rates reflect it. Here's something worth thinking about. If you look at several of the most commonly prescribed antihypertensive drugs, one of their notable effects is that they help retain potassium in the body. These medications work partly by keeping potassium from being excreted. So here's a question worth exploring with your doctor. If part of the mechanism involves potassium preservation, what would happen if you address the deficiency directly through food? And if you're on potassium-sparing medication specifically, make sure your doctor knows before you significantly increase your intake. That's an important conversation to have. I want to pause here, because if this is landing differently than what you've heard before, I want to make sure you don't miss what's coming. Hit subscribe and turn on notifications now. I make videos specifically designed to bridge the gap between what the research shows and what makes it into the average appointment. And please share this today with someone managing blood pressure. They may never hear this from their physician. Now let's get practical. Let's talk about supplements, because I know a lot of people's first instinct is to go buy a potassium supplement. Here's what will probably surprise you. Most potassium supplements in pharmacies contain no more than 99 milligrams per tablet. Your daily requirement is 4,700 milligrams. You'd need roughly 47 tablets to hit your daily target. That's clearly not the solution. There are electrolyte powders with higher potassium concentrations that can be a useful tool. If you're looking at those, here are 3 criteria I use to vet them. No added sugar, transparent dosing on the label, meaning exact milligrams listed, not proprietary blends, and no artificial fillers or dyes. I'll link options that meet those criteria in the description below. But the real solution is food. And here are 5 high potassium options that don't require eating salad mountains at every meal. 1. Spinach, about 840 milligrams per cooked cup. Blend it into a smoothie and you won't even taste it. 2. Avocado, around 700 milligrams per whole fruit. 3. Baked potato with skin, over 900 milligrams. 4. White beans, roughly 1,000 milligrams per cup. 5. Salmon, about 600 milligrams per fillet, with the added benefit of omega-3s for your arteries. These 5 foods alone, combined in a single day, can get you over 4,000 milligrams. You don't have to overhaul everything at once. Here's a simple ladder to make this feel manageable. Week 1, aim to add 500 milligrams above your current intake. That's a handful of spinach in a smoothie. Week 2, add another 500. By week 4, most people are comfortably hitting levels that start to matter for their cardiovascular system. And here's your micro action for tonight. Add 1 potassium-rich food to your dinner. Then tomorrow morning, check your blood pressure. Just 1 meal, 1 data point. See what happens. Now let me address the concern I hear most often when potassium comes up. Isn't it bad for the kidneys? Here's the real picture. For people with healthy kidneys, potassium is not just safe. It's actually protective of kidney function. The concern applies specifically to people with advanced chronic kidney disease, stage 4 or 5, where the kidneys have lost significant ability to regulate mineral levels. In those cases, potassium does need careful monitoring. But for the vast majority of people with hypertension who have normal or near-normal kidney function, potassium is not a danger. It's a nutrient you're dramatically undereating. If you have kidney disease or are on potassium-sparing medications, please consult your doctor before making significant dietary changes. But don't let a concern that applies to a specific subset of patients stop you from exploring whether this is your missing piece. Let me zoom out for a moment, because the potassium story is a window into something more fundamental. We have a tendency to reach for pharmaceutical solutions to problems that may have nutritional roots. That makes sense in some contexts. There are genuinely situations where medication is the right first-line response. But for essential hypertension, where by definition the cause is labeled unknown, it seems worth asking whether the cause might actually be something as straightforward as a severe and chronic deficiency of a mineral our bodies need in enormous amounts and are systematically failing to get. 90% of hypertension cases, unknown cause. Most adults getting less than half their daily potassium requirement. Potassium directly regulating vascular tone, adrenaline levels, endothelial health, and insulin sensitivity. Blood pressure medications that work partly by retaining potassium. At some point, the dots start to connect themselves. Your body is not broken. It is not predestined to require pharmaceutical management forever. In many cases, it is simply running low on raw materials it needs to function. And when you give it those materials, remarkable things can happen. I've put together a free guide, a potassium reset plan that includes a grocery list, 3 smoothie recipes, and 2 dinners that hit your potassium targets without tracking or counting. It also includes the questions to bring to your next doctor's appointment. I don't know how long I'll keep this free before I roll it into the full program, so grab it from the description now while it's available. If this video helped you think about your blood pressure differently, drop a comment below. Have you ever had a doctor bring up potassium? What's been your experience with dietary changes? I read every comment, and your experiences help other people feel less alone in navigating this. If you haven't subscribed yet, do it now. And share this with someone managing blood pressure, because the person who needs this most is probably not going to find it through their doctor's office. They're going to find it because someone who cares about them passed it along. Next video, magnesium, the other mineral almost nobody talks about, and its direct role in blood pressure, sleep quality, and arterial health. You won't want to miss it. This video is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before making changes to your diet, supplements, or medications, especially if you have kidney disease or are taking potassium-sparing medications.